Setting a step count goal is something I typically do with sequence members. I'm often asked how much is enough. So, for people who are at greater risk of any kind of metabolic issue, like the risk of type 2 diabetes, higher step counts are likely more beneficial. For example, a 2022 study out of the University of North Carolina at Chapel Hill recruited almost 7,000 Hispanic adults. Now, over a almost 6-year follow-up period, most of the risk for diabetes was explained by the person's weight status. But the most important thing is how physical activity affects people who are at risk. So compared to adults getting 3,400 steps, those getting 10,000 steps had a 19%, 31%, and 26% reduced risk for diabetes if they were obese, older, or had prediabetes, respectively. Also, getting 17 minutes per day at a high step cadence was also associated with a lower risk of diabetes compared to those who got a lower amount of steps at a low cadence. But again, body weight status explain most of that risk. So for those who are at risk of diabetes, higher step counts, preferably through at least one planned walk per day, can really reduce the risk of negative outcomes, especially when in conjunction with lifestyle and medical treatment.